Hi everybody, it's Dr. Dan coming from the Balancing Center, and we're here today to talk about how our care relates to mental and emotional well-being. And in the body, we talked about timing, toxicity, and thought. We talked about endocrine system, nervous system, and the myofascial system. And chemistry and nerve system and physiology can get stuck in traumas, dramas, histories, and mysteries. Now, one of the examples I use when I'm talking to people in the care is, have you ever seen an angry person walking down the street? And you can kind of see it from across the street. They're like, yeah, I've seen that, I know that. And I was like, well, how did you know they were angry? And it's just like you could see it in their physiology because they're locked into that. And just about every time that there's a intrusion or a stress for them, their initial response is usually going to be anger because that's what's there. So we help a lot of people just by having them get back into alignment with the upper cervical correction so that their myofascial system can give them an experience of self-support. We use the neuroemotional technique, the bioenergetic synchronization technique, and my adaptation of those different systems to help the body update to the current source. Most of the times when there's something stored in the past that hasn't resolved, it's because there's probably an inappropriate meaning attached to it. So something bad happens, the person says, that's because I'm unlovable, unworthy, and that gets locked in as the reason. That can't be filed because that wasn't necessarily the reason. So if we can go back to that time, open the system up, have the person reprocess it on their own dynamic. It's not like we're talking about what was happening. We usually don't really want to get into the story. But the neuroemotional, the mind-body techniques that we use help those come up and surface so that they can be resolved on an energetic level. And in the structural work and the movement practices, that helps the body get a better connection with the ground and a better connection with itself. The Arenda products, taking the otropin back up to the pituitary, which is the master gland, helping it start to create some growth hormone, checking on the thyroid, checking on the adrenals, checking on the sex hormones. And when you get the chemistry balanced, and you get the connective tissue balanced, and you get the nervous system balanced, eventually the body starts to run better and it opens up old files. And then sometimes people will come in and they'll have all these issues, and I'll say, well, when did you have these before? And just like, well, 15 years ago, but that went away. Or, yeah, I had this bad accident, or yeah, I had this divorce. And you've seen people go through divorces, you've seen people go through stressful situations, losing loved ones in a traumatic way, and they've never been the same. So that means that that emotional trauma is locked in their tissues. It's affecting their endocrine system, it's affecting their nervous system, and anything that looks like it, smells like it, sounds like it, tastes like it, or feels like it is going to trigger them. Have you ever known people like that? It's like it doesn't take much, but once you trigger them, there's hell to pay. So when we're working with you, we're resetting the stage with the upper cervical correction. We're updating the programs with the other techniques. We're giving you connection and expression of agency and adaptability and resourcefulness. And that sometimes will start to bring things up for people. And it actually can be a little bit scary. Some people are saying, I'm feeling like this really weird fear. And it just like, so I'll say, well, when did you feel that before? And they'll think about it for a little while, like, oh, that's back when this happened. So there's that aspect of it. And sometimes people will actually feel different feelings and experiences as they're getting better from this upper cervical correction, because as the body keeps moving forward in time, it runs into these camouflaged holes or these traumas, dramas, histories, and mysteries, and the body sort of falls back into it. But now you're not into it at a current situation, you're not into it at the present time, and you can look back on it and talk to yourself like it was somebody else that you're giving advice to. So carrying these other things around, traumas, dramas, histories, mysteries, locked in the body, take up resources that sometimes keep us from majestically manifesting the optimal expression of who we are. And that's really our goal here at the Balancing Center, is to support you in that specific area.